Welcome to this episode of the GHAPP MASLD MASH Community Network podcast. I'm Summer Collier. I'm a nurse practitioner at UC San Diego Health. And today we're talking about something that every primary care provider, especially APPs, need to have on their radar, and that's MASLD, or metabolic dysfunction-associated steatotic liver disease, and its progressive form MASH, or metabolic dysfunction-associated steatohepatitis. This condition is incredibly common, but often undiagnosed and unrecognized, and primary care really plays a critical role in identifying patients at risk for advanced liver disease. So let's start with some basics. So which patients should we be thinking about for screening for MASLD and MASH? So if you are seeing patients with type 2 diabetes, obesity, metabolic syndrome, or even prediabetes, these patients are automatically at higher risk and so should be screened. And so the 2023 MASLD consensus reclassification makes it clear. In the absence of increased alcohol use, hepatic steatosis plus at least one cardiometabolic risk factor equates to MASLD. And so cardiometabolic risk factors, you want to think of an elevated BMI. You want to think of prediabetes or a diagnosis of type 2 diabetes, elevated blood pressure or being on antihypertensive, elevated triglycerides or a low HDL cholesterol value, or being on a statin. And so this is really the patients that you want to be thinking of as far as initiating a screening for MASLD. So think of it this way. If you have patients with metabolic syndrome, assume the liver is involved until proven otherwise. So once we identify a patient at risk for MASLD, how do we screen? What are the next steps? And so my recommendation really is to utilize the FIB-4 index as the first line tool to screen these patients. This is a calculator. It's quick, it's free, and it uses values that you likely already have on hand, including the patient's age, lab values of AST and ALT, as well as platelet count. And utilizing this calculator, you plug in these values, it gives you a reading, it gives you a value, and that value is highly validated and recommended by the AASLD and EASL guidelines as the first line screening to really estimate that risk of liver fibrosis. And so the practical part of it, if you have a patient that you're concerned about that may have MASLD, you have a patient that has metabolic risk factors, you have these clinical values, so the AST, ALT, platelet count, and their age, and you enter them and you get a FIB-4 score. If that FIB-4 score is less than 1.3, you can feel pretty confident that they have low risk for advanced fibrosis or even moderate fibrosis of their liver. And we'd recommend, because those risk factors, don't go away, we typically recommend to repeat that FIB-4 every 1 to 3 years. If they have more than 2 cardiometabolic risk factors, I would recommend repeating that FIB-4 on an annual basis. And if they have, 0 to 1, maybe they just have an elevated BMI, consider repeating that every 2 to 3 years. Now, if you have a value of a FIB-4 that's in this moderate range of 1.3 to 2.66, they're in this indeterminate range. And so the FIB-4 may not be the best way that we screen in or screen out significant liver fibrosis. And so I would recommend considering another tool to evaluate fibrosis of the liver. And this could be a tool you have in your practice setting, like a FibroScan, or a tool that maybe you can refer to radiology, such as the shear wave elastography, or a blood-based tool, such as the ELF test that many laboratories can complete. And that will help to determine if this patient warrants a referral to specialty care. And if you have a patient who has a very high FIB-4, so this is greater than 2.67, well, then they are screening positive for risk of advanced fibrosis. And so this is definitely the patient that you want to link and refer to hepatology or gastroenterology for further evaluation. And of course, just as with any kind of screening tool, there are some limitations. The FIB-4 uses age as one of its values, and so it can falsely be elevated in an older adult population. It can be falsely low in a younger patient population. And so that's why it's important to repeat these assessments on a somewhat regular basis, and you can kind of get a sense of the trending values. And so how do you communicate to your patients when you have a FIB-4 that is suggestive of moderate or advanced fibrosis? But I think the important thing is to communicate to your patient that this warrants further workup, that further evaluation is needed to really understand the health of their liver, many patients with MASLD have been told they had fatty liver before. Some of them may have been told not to worry about it. And so I think it's important to stress the importance of follow-up to get those next step testing or to get that referral placed. But just remember that the initial screening, it's not diagnostic of cirrhosis. Elevated FIB4 does not conclude that they have cirrhosis. It just means that we need more information to assess the health of their liver. And so in primary care, of course, there's so many things to screen for. There's so many guidelines to follow, especially in patients with metabolic disease. And so how can you incorporate this additional screening? How do we think about incorporating this into your kind of normal, busy clinical routines? And so one way I would recommend is thinking about leveraging your electronic medical record. These values, age, and some basic lab values are often stored there. And perhaps you can find a way to automatically calculate the FIB4 within your EMR and then kind of create a red flag system for those that screen in that higher risk group. If you have patients that have diabetes, maybe consider incorporating that FIB4 calculator into their annual diabetes care, just like you would by checking an A1C or a cholesterol panel. And then, thinking about ways to really protocol and a stepwise approach the screening. So you want to first identify, which patients you have that are at risk for MASLD. You want to create a pathway of just simple screening with the FIB4. And then you want to make sure that you have connections to referral sources. You can get your patients that are at higher risk connected to specialty care. And so some closing thoughts I have, MASLD is no longer just a liver clinic problem. It is so common in our patient population that we need everyone's eyes to be addressing the problem, to be finding and evaluating patients that are at risk. It's really should be considered more of a cardiometabolic disease. And that screening and that assessment typically starts in primary care. So by identifying and risk stratifying early, we have an opportunity here to prevent progression in liver cirrhosis, to prevent liver failure and need for liver transplantation. And for patients that maybe we don't know have advanced fibrosis, we have an opportunity to get them into liver cancer screenings early so that we can detect and manage liver cancer when it's treatable. So these are all kind of the benefits and the opportunity of increasing screening for patients at risk of MASLD. So thank you for all the work that you do every day and for tuning in today for this podcast. If this topic sparked questions or interest, visit the GHAPP MASLD Community Network for more tools and education. And until next time, take care and talk to you soon.